Good morning, everyone. Welcome to our second installment of the BC Poultry Symposium. We're very thankful for all this Zoom technology, and I know our families, myself included, with extended families and grandkids, we're going to be using this technology to help us connect during this world distancing situation that we're under. We're very thankful today to have Dr. Babak Sanei join us. First of all, though, I would like to draw your attention to all the sponsors who have been so generous in sponsoring our meeting. The meeting was supposed to be held in the Fraser Valley of British Columbia, but we've decided to extend it over a period of a year with all our speakers generously willing to come on board once a month. So with that being said, I'd like to introduce Dr. Sanei. Babak has worked for, I've known Babak for a couple of decades now, and I've worked with him when he was an extension veterinarian in Ontario for a number of years, where you gather so much experience. And then Babak took off to the United Kingdom, Scotland, where he gained another great deal of experience working for Avigen. And then has recently, since 2013, I believe, is now the technical poultry technical advisor with Zoetis. And we work with Babak a lot, and he has kindly offered to present his information on Colibacillosis prevention and risk strategies and so on. So Babak, I'm going to shut her down, and it's over to you.
All right. Should I go ahead and share my screen? Let me see. Can you see my screen?
Yes. Very good.
Okay. So first of all, I guess I want to thank you, the organizers of the BCPS, British Columbia Poultry Conference, to provide me with this opportunity. I always, I love to travel in May and join the BCPS. It's one of the very well attended and very practical conferences, I would say, over the last few years that it has started under leadership from CPC and Stu. And, with the COVID and all these changes, obviously we are all trying to adapt. So today, when I was preparing to kind of for the presentation, I said I'm going to, just put on my working clothes. So kind of mimic what actually, I was going to present it at the conference if I was in person. So trust me, I don't have pajamas on. So basically I have my clothes on, and it's ready to go. For the presentation, I have a good amount of time. So, I appreciate all the time that I've got on this. So, I want to basically try to do here is to kind of give you a review on Colibacillosis, and focus is on broilers, and basically dissect it from how you actually would have a Colibacillosis break in a given broiler flock. What are the manifestations when it's related to this bacteria? Probably it's one of those diseases that everybody has been, the producers definitely know about it. They have experienced it in their flocks for sure. All the salespeople that work for feed company or the hatcheries and processing, they definitely have also been dealing with. And it's one of those nagging problems that sometimes it can be devastating. At times it can just affect your performance. And there are times that you basically don't see a direct impact, but you just see some kind of a poor performance. Flock is not gaining that weight. FCR is a little bit higher, or cellulitis is high. Mortality is okay. So the idea is to kind of take you through this journey of looking at from different angles, and especially how the bacteria is able to cause the disease. I think understanding that part or reviewing that part is quite important. And then I guess when we get to a couple of more direct impact of E. coli, like cellulitis and some of the others that kind of a concurrent diseases with IBD, then I would also suggest some of the action items that you could take into consideration to deal with colibacillosis. The first slide here, I have E. coli or bacteria, a schematic representation, and the only reason that I put it there is to basically highlight this layer here. It's called LPS, or lipopolysaccharide nature, as for the composition of that material. It's a kind of a wall around the bacteria, and most of the bacteria, like Salmonella has one too, have this layer around it. And this is actually the LPS, or lipopolysaccharide, is what it actually causes the immune system of the bird to react to. So when this comes inside the blood circulatory of the bird, you would start seeing immune system of the bird reacting to it, and then you would have fever. And just by simply like a fever, you would have some impact, negative impact on feed consumption, water consumption right there. So that's part of the, kind of a common thing among most of these bacteria, but especially for this topic, the E. coli one. So I guess, what is the recipe? I call it recipe in the sense that what do we need in order to actually have an outbreak of colibacillosis in a broiler flock or in a bird, for that matter? And so basically you need a bacteria. E. coli is the bacteria, but that's have to say that the majority of the bacteria that we have in the gastrointestinal or gut of the bird are not pathogenic, are not able to cause colibacillosis or disease. So you actually need a certain capability of some of these strains of E. coli that is referred to as avian pathogenic E. coli in a right quantity to be able to cause colibacillosis in birds and broilers, for the topic of today. The other one is you need a susceptible host, and obviously birds are susceptible, and regardless of broilers, turkeys, broiler breeder, layers, all of them are susceptible to pathogenic E. coli, and so it is actually a problem in all species of these birds, commercial birds that we are talking about, and definitely for broilers, because of the very fast growth rate that kind of adds to the susceptibility of the host, because of it's kind of comes as a stress for the bird. Then one thing I guess I will repeat that as we go, is that E. coli, you cannot get rid of it. It's part of the normal gut flora of bird. It's not like viral diseases like reovirus or IBH that you try to eliminate it from a farm. With E. coli, you really can't do much about it. You can't 100% delete the farm from E. coli, even the pathogenic one, because it's actually in the gut of the bird. However, in a normal, healthy bird, the bacteria is in a minority. The strains of the E. coli that is able to cause disease is in minority. The majority of the E. coli are non-pathogenic. And that balance is actually important to keep that bad avian pathogenic E. coli suppressed enough to not causing any disease. Now, the bacteria, we said it's in the gut of the bird, but it has to enter the body of the bird. In other words, it has to access to the blood circulatory of the bird. The portal of entry is basically either through the gut wall, if you have any compromise of the gut integrity due to any kind of a subclinical infection or gut health diseases, imbalance of microflora, those conditions that definitely can open the door for the E. coli to get access to the blood of the bird. For the same token, as I said, if it's in the gut, obviously it's in the environment of the barn, it's in the feces, it's in the air. So definitely the respiratory system of the bird is also exposed to the bacteria. And basically, if you cause any injury of the respiratory system mucosal barrier, which is in a normal bird, it's intact. So that's a first physical barrier against the entry of the E. coli that is in the air. But if you have compromised that integrity, and what can compromise? I think the typical examples are either the barn environment, such as high ammonia. That's one of those that you could clearly see it. A lot of dust in the barn, which probably it's more relevant for the especially layers or aviary layers that are raised on a litter. You would see most of it. And also if you have concurrent infections, and I'm referring to, especially on broilers, we're talking about infectious bronchitis, is one of those that you definitely can injure the mucosal integrity of the respiratory system and allow the E. coli that is in the air kind of get into the blood of the bird. And finally, I guess skin, and especially I'm talking about abdominal thigh, top of the thigh area that basically is not feathered enough. And if you have scratches, obviously E. coli is in the litter, and that can be a good vehicle to kind of inject the bacteria underneath the skin. So some of those management factors is definitely important when it comes to cellulitis, because E. coli is usually what is causing the lesion. And I will talk a little bit more on cellulitis as we go towards this presentation. So I guess the next two slides, I'm basically from a pathogenesis point of view, meaning that once E. coli, the bacteria gets into the blood of the bird through mucus or a skin, it actually, because of that wall that I mentioned around the bacteria, lipopolysaccharide composition of that wall will cause or stimulate the immune response of the bird. And that is enough to cause fever. That is also, if it's certain enough for a long period of time, it also can reduce the feed and water consumption and affect your weight gain. So, just by that step, you would have some impact there. But you need enough number of bacteria, bad bacteria, to actually be able to kind of trigger that. Obviously, the other part of it is that, with that LPS or lipopolysaccharide in the blood, it also increased the permeability of the vessels or the blood vessels of the bird. What that means that the blood or the serum can exceed. With that, the bacteria can also exceed the blood system and actually go and localizes in different parts of the bird. And you probably, most probably, if you are a producer or a sales rep that have been dealing with poultry, if you open the birds, you could see a typical picture down here with some yellowish material around the liver in this case, or around the heart. And that's a kind of a very typical of Colibacillosis. It's not only by E. coli, but definitely E. coli is one of the most common one. In plasma of the blood in birds, there is a fibrinogen. When it gets outside, because of that increased permeability, it will convert to fibrin. Plus, because of that LPS of the bacteria, when it exits the blood vessels, let's say in the abdominal cavity of the bird, or even the leg of the bird, then it will attract heterophils, which is part of the immune system of the bird. So the heterophils plus that fibrin, that's why you see this yellowish, caseous, cheesy material in a typical mortality due to colibacillosis in birds. And that's basically gives you an idea how it is actually induced. As for what are the manifestations of colibacillosis, this list that I am showing to you here, it's not only for broilers, it's basically for all birds like broiler breeders and layers, but I've highlighted those that are important in broilers. Omphalitis yolk sac infection, which is basically the main reason of high early mortality during the first 7 to 10 days of life of a broiler flock. Cellulitis, those two I consider in a localized infection part of it. And I would spend some time on each of those to talk about it. And then the second part, which is the lower part, is the systemic infection down here. With a systemic infection, you have two phases. One phase is the bacteria gets inside the blood, which is called cholesepticemia. And we talk about the respiratory, gut, and neonatal. We didn't talk about it, but it's another way that the bacteria can actually enter the bloodstream. And then after this phase, you have the localization of bacteria in certain parts of the bird. Osteomyelitis, the bone infection, spondylitis, basically that's the typical kind of a look like a kinky back, but it's a bacterial infection of the vertebra of the bird. Arthritis and synovitis is the joint infection, and polycerositis is the one that you see in the next picture. I show you some of those pictures. So the left side, you see a omphalitis, the naval infection in the birds during the first week of life. And then polycerositis, you see here the liver of the bird and the yellowish material around it, that's called perihepatitis. The yellowish cases around the heart, it's called pericarditis. And that's air sac of a bird. It's usually clear. In a normal bird, air sacs are very thin layer that you actually, if you put a newspaper underneath, you could easily read the newspaper. So it has to be really clear. And you see some yellowish, again, that's the typical inflammation of the air sac. It's not caused only by E. coli. So always bear in mind that you see these things, you need to identify, isolate it by submitting samples to make sure you are identifying the cause of it. Sometimes it's also a mixed infection, like E. coli with enterococcus. So all of these can happen in multiple infection. You need to identify it, because also for the treatment, you need to know what you're dealing with. Here, yolk sac infection. Now, this one is navel infection. You see the kind of a reddening around the navel area. You know, when the bird is hatched, you know, it will close this navel as soon as possible. Sometimes it delays that, and that opening there would be enough to kind of suck in some of the contamination that potentially might be in the environment of the hatcher or the chick processing room. And then you have a yolk sac that is quite distended here. That's a yolk sac infection. Another kind of a sign of that here, that you would see infection in the yolk and navel. So when we talked about bacteria, we mentioned earlier about that not all E. coli can cause disease. You need to have strains of E. coli that have ability to cause disease. And what is that ability for E. coli? These are genes that will kind of show in a form of a certain virulence genes that have been identified over years by microbiologists. There's a quite variety of the genes that have been identified that is associated with E. coli infections. These are some of the more important ones. And the way that we look at it is that in order for you to have a colibacillosis, you need to have an avian pathogenic E. coli that has at least 4 of these genes. And it can be as high as 9, it can be as low as 4, but you need certain number of these genes in that bacteria to be able to cause disease. So you need a bacteria that has these genes, and then you need enough number of that bacteria. So these are the 2 important factors for colibacillosis when you talk about the bacteria part of it. And I did tell you that we call those bad E. coli bacteria, we call them avian pathogenic E. coli, or extra-intestinal pathogenic E. coli. In birds, unlike cattle or other species, E. coli usually doesn't cause diarrhea inside the gut of the bird. Usually it is causing problem when it actually gets inside the blood. And those portal of entry that I talked earlier, you know, kind of our main vehicle in order for the bird to get infected and to cause colibacillosis. As I said, only 10 to 15% of the total E. coli that is present in a normal, healthy broiler chicken is actually APEC, is bad E. coli. 85%, 90% are those E. coli that are not pathogenic. And that balance of proportion is actually important because it suppresses the APEC, make them be quiet and not to proliferate and cause problem. As soon as you have any kind of a disturbance of that, and that's true also for Clostridia, when you talk about necrotic enteritis, the same thing. If you screw up with that balance, then you are asking for trouble. So any gut imbalance would actually be important in this case. Okay, so on the host factor, so we talked about, I think we talked enough about the bacteria. The second part, I want to talk about a little bit of the host factor, and we did talk briefly about some of those kind of intrusions or concurrent either management or other diseases that makes it possible for some of these E. coli to actually get inside the bird. And I have here, if you injure the mucosal barrier, either being a respiratory system, either being a skin, either being the gut, you actually can have the bacteria inside the blood. And I have probably a common example in broilers, which is more of an issue now, especially in the Eastern Canada with the DMV 1639. That becomes very important because this infectious bronchitis will make damage, micro damages to the mucosa of the respiratory system, and then the E. coli can get inside. MG or Mycoplasma gallisepticum is more of an issue in the long-lived birds. So if they are infected with Mycoplasma gallisepticum, mainly I'm talking about turkeys and broiler breeders, then that's another one diseases that can cause and predispose for E. coli infection. And then you have dust, too much dust. Aviary system is probably one of those form here. And then ammonia, high ammonia, especially in the winter time, because if you reduce the ventilation to conserve some energy, you actually increase the amount of ammonia, and that would be enough to cause injuries. Disruption of the skin, we talk about cellulitis. Obviously, there is a lot of management factors. We will talk a little bit about that, so I won't spend much time on cellulitis here. One of the things that I want to highlight to you is that, especially when it comes to colibacillosis, the immune competence of the bird, of broilers, is extremely important. So do not underestimate if you have any evidence of any one of those immunosuppressive diseases. And probably the most common one is IBD. If you see high titers at the processing, regardless of if you don't see any mortality in the birds, let's say your flock didn't have any problem with the mortality, because the IBD by itself, these are subclinical IBDs. They just cause immunosuppression. So if it happens late, you may not even see impact when the birds are inside the barn, but then it may actually increase your cellulitis. In other words, it will reduce the ability of the bird to fight against any kind of scratches, meaning that the E. coli coming from outside, going to the skin, or even inside. If you have any entrance from inside and the bird is immunocompromised, then that E. coli, actually, there have been cases that even internally can go and localize in the skin. Majority of the cellulitis would be more related to the external, going inside the skin by scratches. And then overwhelming exposure when it comes to yolk sac infection is definitely important. And for that, I probably, after this slide, I will talk a little bit about onpholitis. But this slide, I just want to summarize the relationship between the avian pathogenic E. coli and the quantity of that bacteria. So as you go from this left side to the right-hand side, the more avian pathogenic E. coli you have, the more chance of severe colibacillosis outbreak. You're going to have more mortalities. You're going to have more impact on the flock. On the y-axis, you're talking about predisposing factors that I kind of gave you an examples earlier. So the more predisposing factors you have here, then you are going to end up with a severe cases. So this quadrant on your top right-hand side, which I wrote most severe, that's when you have the very aggressive E. coli strain, meaning that a E. coli that has 9 of those virulence genes, and you have a lot of that bacteria in the bird. And then you also have a lot of predisposing factors. You do have IBD in the flock. You potentially have high ammonia in the flock, or you have, reovirus, inclusion body hepatitis. All of those would definitely increase the severity of your colibacillosis. If you have less of that, if let's say you have an avian E. coli that is not very virulent, then if that you basically have a less severe cases. And also, if you have less of these predisposing factors, if you have a good flock that is not affected by IBD, if you have an ideal brooding, especially during the first few days, that's very critical. I know CPC has that platinum brooding concept. So, because of the importance of that first few days, it's important because in a sense that you actually reduce some of these predisposing factors for a bird at earliest stage that is very susceptible to E. coli infection. Okay, so let's talk a little bit on omphalitis, which is infection of the navel, and yolk sac infection. And both of these, there's a quite range of bacteria and others that actually can cause yolk sac colitis. And I have mentioned some of these. E. coli is definitely one of the most common one, but you could see with Pseudomonas, you could see Enterococcus, you could see a Staph, Bacillus, and others that can also cause yolk sac infection. Now, for the yolk sac infection, yolk sac colitis, I guess, from a scientific terminology, that E. coli can come from GI, the same as I said. It can come from air. It can be air from even the hatchery environment, and also it can come from the contamination of the hatching eggs at the breeder flock. So you actually, if you don't have a very good proper egg collection, you basically have a lot of floor eggs with a lot of dirty around it. That bacteria can penetrate when the egg surface pores are still open, and actually the embryo is even infected during the first early stages. And then the same bird can, after hatch, if the number of bacteria was not enough to kill the bird during the hatching, some of these birds would actually carry up some of those pathogenic one to the broiler farm, and that's probably some of the cause of first week mortality that we talk about, yolk sac colitis and omphalitis. So it can be a combination of those and some of these terms like mushy chick disease. You could actually look at the navel of the bird, and so if you have enough number of the bacteria that can cause embryo mortality, so the bird is not even able to hatch anymore, or if you have a very highly pathogenic present, the first week we would see a very high early mortality. But if the birds don't die during that period, some of these birds may be actually a source of infection later on, and sometimes they end up with more lameness too. Not all of the lameness is this way, but it can be one of those areas. So, I guess it's needless to say, when it comes to first week mortality, you look at the egg collection at the breeder farms, you look at the health of the breeder flocks, because some of the infection can go through the reproductive system. For example, salpingitis is the infection of the oviduct in the breeder flock. So if it's infected, it can kind of actually infect the yolk, and the bacteria actually is within the egg. And then your hatchery sanitation is obviously, it's another component. I think these are all obvious, areas that everybody will think about it. Our hatcheries and broiler breeders today are very aggressively looking at options. They use live E. coli vaccination. They have a good collection of the egg at the farm, and the same thing with a lot of critical control point monitoring of the environment of the hatchery in order to identify if the hatchery sanitation is not at par, at ideal level, and they address it. So, most of these are addressed, but there are times that you would end up with some of these. So it's an ongoing thing that you need everybody at whatever role they are, they have to watch for it to be able to control it. I have some of these hatchery, more kind of a micromanagement when it comes to humidity and temperature within the hatchery that kind of it delays, for example, the navel to close and more chance of bacteria get in. But I won't go into that part that much because of the time. But also, I think it demands a different type of a presentation if you want to really dig down into some of the hatchery or breeder flock side of it. Without any doubt, the brooding management, the last item on this topper part, is another component. That's definitely a part that our broiler producers have clearly an important role in it. As I said, during the first few days, that's the most susceptible part. So that's the part that you want to avoid any kind of a feed disruption. You want to avoid any water disruption. You want to avoid poor air quality. You want to avoid any heat or cold distress. Yeah, all of those that comes with the brooding management that is usually covered through different courses like platinum brooding as an example of it. So that's actually very critical, and it's something that we could do it and control at the farm level. In fact, this brooding management, if it's done properly, even if you get some bacteria through the breeder and the hatchery, you could actually reduce or minimize this to great extent of the negative impact. It all depends on how much bacteria you have in a bird that you are receiving. So even if it's a low number of the bacteria in them, with a good management, you'll be able to actually divert that and actually end up with a decent flock at the end. Okay, so I talked a little bit about yolk sac infection on pholitis. I think it would be important for me to also talk a little bit about bacterial lameness. And when I talk bacterial lameness, obviously there are several bacteria that can, commonly can cause lameness in broilers. But I wanted to kind of take you through this small kind of a journey on explaining how at least researchers or most kind of a recent hypothesis of how this bacterial lameness actually happens or established in a broiler flock. And it's needless to say that E. coli is one of those bacteria that has commonly been able to cause that localized infection. But obviously, Enterococcus cichorum, it's another one that these past, I would say 4 or 5 years, has caught many attention. Part of it is the labs also all better to isolate and identify it, but definitely it looks like they are also gaining more pathogenicity there. And a staph is another one. For the sake of this presentation, obviously our topic is on E. coli part of it. There are 2 stages, and that's kind of a similar on the same line that I mentioned to you earlier. You need to have the bacteria first in the blood of the bird. So we refer that to the septic phase, meaning that the avian pathogenic E. coli enters the blood circulation of the bird. And then after the septic phase, you would end up with the skeletal phase, where the bacteria exits the blood and go localize in joints or different parts of the skeletal system that I will highlight later. But definitely you do need the septic phase. Sometimes you would not even notice septic phase, depending on how much of that bacteria, APEC that we mentioned, are within the blood of the bird. You may actually see a peak in the mortality around 2 weeks of age in a broiler flock. You open the birds, you see a typical lesions of the E. coli, you send it to the lab, yes, it's E. coli. But sometimes you don't see that phase. You don't see much of a mortality going up. But then it goes to the second phase, around 4 or 5 weeks of age, you start to see a lot of leg problems, and it's bacterial. You send it to the lab, it comes back as E. coli. Sometimes it comes as E. coli and Enterococcus cichorum, sometimes as a staph. So definitely you need to identify what is involved, because sometimes I have seen people call it E. coli, but when they send the sample to the lab, it comes back, actually it's Enterococcus is causing it. And sometimes there are both. So you always need to know what you are dealing with. But this one, the skeletal phase, comes after the septic phase, meaning that after the bacteria gets into the blood, exit the blood, and then goes and localizes. The most common areas in the birds basically are, I will show you in the next slide, but basically these are some of the lesions. You either have a spinal lesion, and it's also the term is a spondylitis. Both E. corum and E. coli can cause it, and it's kind of a typical kinky bag shape of it, because the kinky bag by itself is not infectious, but the spondylitis, which is very similar, bird sitting on the hawk and cannot move, it's a lesion in the vertebra of the bird, the movable part of the vertebra. There's only one of those thoracic area that is infected. Then femoral head necrosis, and then infection of the bones in general, it's called osteomyelitis. And then synovitis is infection of the synovia, the membrane that kind of surrounds the joints of the bird. These are the three most, or I guess I said three, but there are four most important localized area that you actually end up with leg problem and causing lameness in birds. One is femur or thigh here. That's where the femur is joining the hip of the bird. And the infection here is called femoral head necrosis. When you kind of disarticulate, you actually break it off when it's really severe. Then you have this one, which is tibia, the proximal or this end of it, when it's joining with the femur. It's also commonly referred to as drumstick. That's another part of it, and I show you a cut of that part. So that's one of those areas that I look at when you open the bird. This one here, and also this one, which is the hock joint of the bird. And these are the three main ones when you talk about lameness. But also the fourth one would be the vertebra, which I mentioned in my previous slide, which, E. corum and sometimes E. coli, or sometimes both together, can cause infection. But the question is, why? Why only these joints are affected? Mainly it's because of the growth rate. Not that we are blaming everything on the growth rate, but the fact is that the bird has to grow from around 40 to 50 grams when they are hatched to around 2.4 kilogram, that area, around 34 or 5 days of age. So that's a significant amount of growth, and a lot of meat on the bird, but you also need to have a very fast growth of these bones. And these bones, especially this bone, the tibia and femur, they are growing so fast, 3 to 5 times than the rest of the bones in the body of the bird. And the growth is especially on the ends of these bones here. This end, which I said about femoral head necrosis, it was one of the lesions, and also this proximal of the tibia that I mentioned. And these are the most fast-growing part of the skeletal system, and that's the main underlying cause of being more susceptible for bacterial infection too. This middle picture here is the cut. So if you, in a 45-degree angle, you cut here and put it under my, basically looking at it grossly, you would see different part of it. On the left-hand side, I wanted to show, so that's the same thing on the left. It shows you the blood supply to this from this kind of artery on the top, and there's one on the bottom. But this one, as you could see, when it goes, these are cartilage. The cartilage usually, it's a kind of a walls of parallel, but they are very poorly organized in a sense that they are not very stable. But also look at the arteries becomes thinner and thinner and thinner. So you actually have a very, very thin arteries when it comes between these. Because of the very fast growth rate of these side of it, because of the kind of a poor vascular supply here, this end of these bones actually are prone to microfractures, that these microfractures, if then you have the bacteria in the area, in the blood, that actually can go and localize. So the microfracture is not enough to cause lameness. You need the bacteria to actually go and localize it, increase in number, and then cause inflammation and cause lameness. Not every flock, even in a healthy flock, you may find some of these. That's part of that growth, fast growth that I mentioned. But if you have enough number of bacteria and you have these macrofractures, because it kind of interferes with the blood supply, the oxygen doesn't get there, and lack of oxygen, presence of bacteria together, it's enough recipe for the bacteria to localize, increase in number, cause inflammation, and eventually lameness. And that's what I'm showing here. So you basically have fast growth, you have mechanical stress due to this fast growth, which kind of causes microfracture here. These microfracture would further interfere with the blood supply. If you have the bacteria in that blood, and I will talk a little bit about where they come from, the same thing that I have mentioned throughout this presentation, they actually go localized and then cause a lot of infection and lameness. And it basically happens in the fast growing bones. And that's what I mentioned, the growth plate, microfractures in response to mechanical stress, and then blood circulation disturbance. And then if the pathogenic bacteria, and this is not only about E. coli, it can be true for Enterococcus as well, and also staph too. If they get inside the bird, because they are out there, they are part of the normal gut flora, and they are on the skin. Staph is in the skin, on the skin of the normal healthy bird. So if you damage any of these barriers, they can actually go inside the bird. So it can happen in a broiler farm. It can come with the bird. So both of them is possible portal of entry for the bacteria that we have been talking a lot about it. And without any doubt, immunosuppression, and I emphasize on this because I truly believe as a veterinarian, we underestimate some of these variant silent IBD infection. We see some titers at the processing. We don't get much excited if we don't see a direct impact on the performance. But many times over time, you would actually start to see impact on the performance of the flock. Even without mortality, you start to see a little bit more FCR, weight gain is affected, and probably one of the more common one, you would start to see more and more cellulitis, because you have an immunocompromised bird that is basically all it needs, some of those scratches and E. coli pathogenic to go there and cause more cellulitis, which I know it can happen. And this is kind of a pulling together everything that I said. You have basically respiratory mucosal here. You have the intestinal epithelium here. And basically what it says that if you have injury to these barriers, then the bacteria will get inside the blood, goes inside the blood, migrates to the bone here, and it's there and waiting for an opportunity to basically localize and cause lameness. And that's the dynamic. And this article here down here obviously is a good review. This picture is actually from this article. I want you to basically, if you don't get it right now, just let me know, and you could email me, and I would send you the reference link. The reference for that article, so you could actually go and get it. So when it comes to the lameness, you need to, obviously, there is a before getting to the broiler farm, the hatchery and egg collection is one part of it, but also you want to avoid any leaky gut when the birds get into the broiler farm. That goes to that brooding management that I talked about. The heat stress either at the farm or at the hatchery are extremely important. You could use live E. coli vaccine at day one. Basically what it does, it kind of reduces the amount of the APEC in the gut numbers, but also if it gets to the blood, it kind of helps the bird to kind of reduce the lesions caused by it. I would show you a little bit of experiment we did on some of these flocks with E. coli problem as I get to towards the end of this presentation. This article also talks about sometimes a certain probiotic seems to help with the gut flora balance and therefore reducing some of these bacterial lameness. And I talk about IBD infection as an immunosuppressive also. Cellulitis, I want to spend a few minutes on the cellulitis because definitely that's one of those obviously infection or condemnation that if it's severe enough, they will condemn the whole carcass or treatment. So basically it's a lot of economical loss to both broiler producers and industry and processing. And there is a wide range of predisposing factors that if you go to the literature, you could actually look at it. And I actually have it in this slide. They talk about the skin integrity. They talk about the ratio of the nutritional factors. They talk about sodium level in the diet. To me, though, the nutritional factor is unless you have a severe problem in a diet formulation, which usually in at this time of the period, you have all these nutritionists on top of this diet formulation, you rarely see that as a source of a cellulitis problem. I know that's definitely not on my top of the list to look at if I have a lot of cellulitis in my region. There are indications that you could actually improve the integrity of the skin with additional vitamin E and some inorganic zinc supplementation. So that has been mentioned in some of the literature. And there's these down here is the list of all the management factors that you refer to. Stocking density obviously is one of those because the more bird, more chance of scratches. Definitely that would be one part that you need to think about when you talk about it. But if you always have the same stock density and then suddenly you started to see elevation of cellulitis in a region, then you also have to be open-minded, look wider there. So some of these are management practices that we talk about it. And probably it might be more important if you are dealing with a one farm that have the problem. If you have basically a number of farms within your region that you are supplying, either you're providing the chick or you're providing feed, if you have that problem, then that means that it's not a specific problem on a given farm. It might be something else. And I think one thing you need to rule out, and I say it as a veterinarian, if I was a veterinarian, the first thing I would rule out is that, do I have IBD problem or not? As I said, it's a variant IBD. We don't have classical IBD, unlike other parts of the world. So these IBDs do not cause direct lesions or mortality in birds, but they are immunocompromising agent, virus. If you see high titers in ELISA at the processing, do some molecular tests, identify what is causing it, what variant is it, and then work with your veterinarian to really address it. There's management practices, cleaning and disinfection, and there's also manipulation for the vaccine that you do in the flock. Our broiler breeder industry, I would say that's true for across Canada, are hyper-immunized for IBD, meaning that the vaccination is actually quite ideal, and the maternal antibodies for IBD that transfers to the broilers are actually quite at a good level. But that maternal antibody would protect the broilers for as far as around 20 days, not more. Ideally, it's around 2 weeks. That's the peak of it. Gradually, the maternal antibody will wane. So if you have the variant in the barn, in the farm, then after 21 days, that's where they started to cause problem. And because it gets closer to the processing, you may not noticing it right away, but it will cause high titers at the processing, and it may also see a high cellulitis. So make sure you deal with it. And also my sincere suggestion is do not underestimate if you just see high titers, because as I said, sometimes it's kind of a sneaking on you and gradually cause more and more problems. As for the way you look at it, live E. coli vaccine has been used, and actually I will show a trial that we did with the Canadian Poultry Consultant in BC last year. That kind of I want to discuss some of those measures that you could take. These are the ways that the vaccine hypothetically would work: reduce the APEC in the litter, reduce the APEC in the gut of the bird. And obviously, if the E. coli gets in the bird, helps the bird to kind of cope with the infection. I said that, but without any doubt, the E. coli vaccine by itself would not be the only solution. If you do also have an IBD immunocomp, you need to address those predisposing factors at the same time. The E. coli vaccine would help, but you need to look at the vaccination for IBD, D if it's IBD, or if there's other immunosuppressive, IBH another one, Rio another one. But if you are dealing with those, be very open-minded when you think about cellulitis at the regional level. So I have about 10 minutes, so I think I'm good in kind of a touch on a study we did, kind of a field study. It's a small. When US does these trials, it's usually million birds kind of a trial, meaning that you can vaccinate with the E. coli and then don't vaccinate for a couple of weeks and kind of compare overall million of birds. We don't have that ability to do it in Canada. And so this one was with the support from highly professional CPC colleagues, Dr. Gigi Lee and Lindsay Keller helped with this. Basically, we selected 7-8 farms that had the recurrent history of E. coli infection. And we use that flock as a baseline, meaning that we want to know what was the level of E. coli, either from a mortality, weight gain, and also cellulitis level. Then we vaccinated for 3 flocks using the live E. coli at the hatchery, and then looking at the result of it. Similar to all the trials, it's not 100% black and white, and that's why I want to kind of show you some of those areas that really the vaccine helped. In 5 of these 8 farms, we see, especially if you look at it here, I'm talking about mortality. So the first row is the flocks that were not vaccinated. So, before vaccination was 7, 5, 5, 4, 5. And when we started the vaccination, as you could see, there was a pattern that over 3 flocks, you would see a reduction. As I said, it's not a 100% go back to 100% normal, but definitely you see an improvement in majority of these 4 farms. You don't see much of a change here. And the reason, at least on this particular farm I was a high first week mortality, so around 3% mortality here. But also there were other 2 farms that we didn't see the improvement. And I will talk a little bit about that towards the end of it. But obviously, in those 4 farms, you actually very clearly see, and these numbers at the bottom shows the change from vaccinated at the end of the 3 flocks versus the non-vaccinated, about minus 130%, the reduction, I guess, of the mortality rate. When you look at cellulitis, and again, on the 4 of, if the cellulitis is around acceptable level, an acceptable level to me ideally is 0.67 up to about 1, like this one, Farm G. This is the kind of a threshold, in my opinion, for British Columbia to say, well, it's okay. I like to see it under 1, but that one, the vaccine, we don't see much of a change after it. But very clearly, you see it on some of these farms that like for example, the higher the cellulitis, you actually see a quite improvement as you go through these 3 flocks. And again, that shows basically 116% reduction from when they were. So these are 4 consecutive flocks within each of these farms, farm A, B, C, I, G here. And these are the farms that we saw a cellulitis improvement out of that 8 farms. On average of about 5 farms, cellulitis reduced from 2.0. So 2.07 is the average of these on the top, and then 1.12 is average of these last flock on the bottom. Average live weight at 36 days, roughly there, adjusted for the 36 days. 5 of those farms, we saw an improvement there. And the improvement is around 120 to 140 grams. Again, down here, I'm saying the average of these non-vaccinated on the same farm versus these averages here for each farm after 3 consecutive flocks that received that E. coli vaccine. from 2.08 kilogram to 2.22 kilogram on average. So there was an improvement on the average body weight on 5 of these farms. And then 6 of these farms, you would see the green ones, actually it's average daily gain. So you actually 78 grams and then 62 grams, so forth and so on. The average of non-vaccinated versus vaccinated one at the end of the 3rd flock on average was around, this was about 57.9 for 58 grams per day versus 61. So about 3 grams per day improvement. So now, if you ask me, obviously you're in your mind say, well, but it didn't happen in all of the farms. What was the reason? And I think that's where you need to definitely think about what other things are happening. You know, the E. coli vaccination is one tool there. It's not going to compensate for concurrent infections. It's not going to compensate for management, brooding. You know, if you have a lot of bacteria coming from the origin, all of those things would actually tell you whether or not you know, how much of a benefit you are going to see with the vaccination. So vaccination is just an additional tool, but you need to have a collective plan to address an E. coli problem. These 2 farms, we didn't see it, but look at each of flock. You know, thanks to CPC to actually identify anything that was happening on that farm. You open a bird, you see Colibacillosis, and we say it's a E. coli problem. But in fact, you see in every flock, you have something. You have IBH and Rio diagnosed at 21 days in flock 1 in farm F. Flock 2, you have E. cicorum and SE isolated, no E. coli isolated. So the lesions here actually is quite similar to Colibacillosis. End of flock serology of IBD and IBV. So even if you have a Colibacillosis in this case, you still need to address these 2 in order to get the most of it. That vaccination is part of it for E. coli, but you need to also address these 2. Farm H, IBH at 29 days, Rio IBV, IBH at 20 days, Rio serology confirmed, and then this one had high early mortality, but also Salmonella enteritidis was isolated in those flocks too. So I guess my point is that, you know, when you are thinking what to do when you have a problem within the flock, you need to think about collectively. Just to wrap up within the next couple of minutes, these are my comments. So you need to think about what is involved. So if you have a Colibacillosis, always think about out of box, identify anything that is present there. I think E. coli vaccination can help you to reduce cellulitis, but you also, as part of the overall problem, solution in a given region. Think about IBD, use the live vaccination, but also think about other factors, especially if you have cellulitis as a problem in a region. When dealing with the recurrent E. coli infection, you need to think about predisposure. I already mentioned that. When dealing with the bacterial lameness, always identify the bacteria. If it's a bacterial, do the antimicrobial sensitivity, because the treatment would be important to know what is the bacteria you're dealing with. And without any doubt, antibiotic treatment has to be started. In order to really be effective for the bacterial lameness, you have to start it as early as possible, because antibiotic cannot treat your lame birds. The idea is to kind of reduce the number of bacteria before it actually goes to the leg and localizes, because as I said, it's in the blood of the bird. So the treatment antibiotic would be effective when the bacteria is still in the blood and not localized. But you need to know what bacteria, and you need to do antibiotic sensitivity test. And with that, you know, I finish my talk. You know, I don't know if you have a time. I just see one question here that was talking about, is there any test to detect the vaccine after administration and to differentiate it from field E. coli? Absolutely, there is. You know, you know, as a provider of this vaccine, sometimes we get the question, can the vaccine cause actually E. coli infection? It is extremely low, extremely low. I have never been, exposed to any evidence to show that. But to answer your question, we could easily differentiate the bacteria from the vaccine strain. The lab, there are special media that we could relate to the diagnostic lab in a region that they could actually use that media to differentiate. The vaccine does not grow in that media. The field bacteria would grow definitely in that media. So yes, you definitely can cause differentiate, and there's no way that it really, I would say, I won't say 100%, but 99%, the vaccine is very, very avirulent, meaning not able to cause disease.
Thank you very much. Your presentation was outstanding, and your timing was even better. Exactly 1 hour. I want to thank everyone for attending. And again, please visit our website for the sponsors. And I look forward to the next couple of months in January and in February, where we're going to focus on water quality and continuing our BCPS. So Merry Christmas, everyone, and Happy New Year. Bye-bye.
Hello, Sue. How are you? I was clear. Like, was there any as for quality? Okay, that's fine. No, that's great. That's it's good for Zoetis too. Definitely, it's very good. No, that's wonderful. I definitely at the end of the part, I wanted to because I think that was actually a powerful trial that we didn't have an opportunity to actually present it anywhere, and I think that was a good. Yeah, yeah. No, no, that's right. Yeah, that's the only way you could do it with virtual, because otherwise you would